This video is going to cover 3 disabilities: Down syndrome, intellectual disability, and cerebral palsy. First, we have Down syndrome. Down syndrome is caused by an additional 21st chromosome, and it occurs in 1 in every 691 babies. Common physical attributes include low muscle tone, small stature, and an upward slant of the eyes. In almost all cases, Down syndrome is also coupled with an intellectual disability. There is one type of Down syndrome known as mosaic Down syndrome, which occurs in about 2% of all cases, and an intellectual disability is not always present in individuals with mosaic Down syndrome. By and large, however, individuals with Down syndrome typically have an intellectual disability as well. So let's continue this conversation by talking about intellectual disabilities. There are multiple modes of diagnosis for an intellectual disability, but most consistently they keep the same initial guideline of having an IQ of 75 or lower. With intellectual disability comes struggles with intellectual functioning, such as difficulty with learning, reasoning, and problem solving. There's also struggles with adaptive behavior. Many individuals with intellectual disabilities have lower conceptual skills, which revolves around language and literacy, money, time, and numerical concepts. Struggles with adaptive behavior can also include lower social skills, which pertains to things like interpersonal skills, social responsibility, and social problem solving. Lower practical skills is also often present, which includes activities of daily living, occupational skills, or just following schedules and routine and safety guidelines. Intellectual disabilities can stand alone or be present in other disabilities, such as Down syndrome, like we just talked about. Lastly, there's cerebral palsy. Cerebral palsy is an umbrella term referring to neurological disorders that affect a person's ability to move. CP is broken down by the way it affects people's movements, the parts of the body affected, and by how severe the effects are. Spastic is the most common, impacting more than 70% of individuals with cerebral palsy. People with spastic cerebral palsy have stiff, tight muscles and affected joints that can be rigid or difficult to move. 10 to 20% of individuals with CP have dyskinetic cerebral palsy, which generally involves movements of the body that are outside of the individual's control. Lastly, ataxic cerebral palsy impacts up to 10% of individuals and involves tremors that occur with voluntary movements. Cerebral palsy is caused by damage to the developing brain, either during pregnancy or shortly after birth. Because of this, it is the most common physical disability in childhood. Cerebral palsy is permanent and lifelong, but generally does not worsen over time. People with cerebral palsy are likely to also have other impairments in addition to CP, not always, but often. For example, 1 in 2 have an intellectual disability, 1 in 3 use a wheelchair, 1 in 4 have epilepsy, 1 in 5 use alternate modes of communication, 1 in 10 have a severe vision impairment, and 1 in 25 have a severe hearing impairment. Individuals with Down syndrome, intellectual disabilities, and cerebral palsy have a multitude of strong skills and positive qualities, and we will dive into how to support these skill sets and qualities in later videos.